mostly I will focus on organ or kidney transplant recipients, but also mention about other organ recipients. This is the website provided by Mayo Clinic that shows the general benefits of physical exercise. This is just for the general population. That exercise, there's expected benefits. That exercise controls body mass, combats many conditions, improves mood, energy, gives better energy, provides better sleep. And it's also funny and even sexy. But the question arises whether the same effects are expected in organ transplant recipients. In fact, the benefits, the likely benefits of exercise training in transplant recipients are extrapolated from the studies in the general population. And we know that exercise may reduce cardiovascular risk through the effects on blood pressure, triglycerides, improve insulin resistance, and improve glycemic control. But it's also from the studies in general population, we have very scarce evidence in patients after organ transplantation. In fact, there are many areas of uncertainty in organ transplant recipients. First, the effect of exercise on nutrition, then on daily life activities, the highly controversial issue of left ventricular structure, the effect on blood pressure, the effect on graft function, and we also need to take into account that exercise programs that are supervised require much staff and are costly, take time, and there are new, of course, interventions, but they are not adequately studied. In trials in interventional studies, there is a very high dropout, and the time of the studies is rather short, up to 3, 6, sometimes, and rarely up to 12 months. So long-term effects are generally not known. The recommendations on exercise in transplant patients are based on epidemiological observations, and not interventional studies. We also know that there is some acute effect, potentially negative effect of the especially vigorous exercise on the risk of myocardial infarction. But we know even so that the patients who are active after transplantation, we know it from the general population, but we also have some data in transplant patients that comparing active to inactive, active people have lower overall risk and live longer. So there is a general rule that we have to go slow and go low. After hearing the presentations yesterday and the day before, I'm not so sure if it is not a good rule for all, maybe for majority, but not for all transplant patients. First, I would like to review the guidelines. What are the current guidelines on various organ transplantations? We are happy, I'm a nephrologist, so we are very happy that we have KDIGO, our global guidelines. It's like a Bible for nephrologists. So we have very nice guidelines from 2010 on the care of kidney transplant recipients. But I looked at the information, any information about the exercise and physical exercise and activity in our guidelines. I found only just a small mention that it's strongly encouraged to follow a healthy lifestyle, exercise, proper diet, and weight reduction as needed. I look also for activity, but I found only once it was in the chapter meaning something different in a chapter fertility. So this is just our guidelines. In fact, we should rely on the various reviews. This is the review written by Patricia Painter, very known researcher in this field, and she compared the patients with chronic kidney disease and also the patients after the transplant recipients who have also who are classified also as chronic kidney disease as compared to community dwelling older adults. So in fact, we try to implement the guidelines that are used for older adults. The guidelines are very well known and were published several years ago in the circulation. And this is the high high-level evidence that we have to promote and maintain good health, that older patients should have a physically active lifestyle, and the physical activity they need to perform is the rule that it's 30 minutes of moderate intensity for 5 days, or more intensive exercises for 20 minutes for 3 days, on 3 days of each week. There are also guidelines, of course, separate guidelines for the heart and lung transplantation. This is the guidelines, and when I look at the exercise, I found only the mention of the patients with diabetes, that exercise helps to control not only body mass, but also diabetes, provide better diabetes control, and also that helps to control blood pressure and prevent fractures. Those are also extrapolations mainly from the general population. But of course, cardiologists are known for cardiac rehabilitation, for the involvement in cardiac rehabilitation. So this guidelines, in fact, provide some hints about the use of aerobic exercise training and also resistance training. So probably those guidelines are the best guidelines among various organ transplant for the recommendations for the various organ transplant recipients. About liver transplantation, we also have the separate guidelines. The physical exercise is mentioned as a way to control body mass. We know that most of the patients after liver transplantation have some fulfill the criteria of the metabolic syndrome, so it's a real problem, and also to control blood pressure and to control lipids, and also in case of new developing diabetes mellitus or pre-existing diabetes mellitus, it's also possible to change lifestyle and exercise. What is the evidence from the current trials on the benefits of physical exercise in organ transplant patients? In fact, we have some evidence. We don't have evidence based on hard endpoints, but we have the observational studies. This is one of the biggest observational studies in kidney transplant recipients. This was physical activity assessment was based on questionnaires, was not directly measured. And the patients were followed for up to 6 years, and it was really found that those who were active, who have an active lifestyle, were less likely to die than those who were inactive. But in fact, it mostly dependent on pre-transplant physical activity. Those who were physically active pre-transplant are very likely that they will be physically active after transplantation. When they looked at the physical activity in the kidney transplant cohort, it was found that there were huge variations, huge differences in the physical activity. And in fact, the majority of patients, more than 2/3, were physically inactive. High active was only nearly 10%. And in fact, the level of physical activity predicted the outcome. And the more active patients were less likely to die. And also, there was a lower rate of death with functioning graft. There was a subgroup of the patients who have repeated the questionnaire at 11 months for transplantation. And what was found that 2/3 of the patients had no change in physical activity. Some increased activity, some decreased, probably those patients with complications. So it's a real area for us to improve the situation, because it seems that those who are inactive will become inactive, those active will stay active. In fact, the evidence that comes from the randomized controlled trials in organ transplant patients, especially in kidney transplantations, is very limited. This is the recent review of the effects of exercise in the whole spectrum of chronic kidney disease, covering also the kidney transplant recipients. There were 59 articles, including in the systematic review, but only 3 articles were in transplanted patients. One was 24 weeks of exercise in a very small population of 12 patients compared to the other 12. And there were also much longer, up to 1 year observations or interventions in the patients, transplanted patients, with supervised exercise at the beginning, and then it was continued at home. And they found some changes, mainly the physical capacity, but in fact those were all surrogate endpoints. So this is the trial. What's important? What was important that the percent of patients participating in regular exercises actually increased after 6 months, and even more after 12 months. But unfortunately, the number of the patients who finished the whole program was just a half of those who started the program, and also improved the capacity was also improved. We expect that more, let's say, much higher evidence is given by the trials in patients after heart transplantation. And this is the first randomized control trial in this population of heart transplant recipients. And I show in the red font the major weaknesses of such research. Just 12 weeks, 22 patients, and various time after kidney transplantation. Supervised aerobic and strength training was compared to no trainings, and of course surrogate endpoints. And in fact, there is an even meta-analysis of the exercise training in heart transplant recipients. There were 6 trials suitable for analysis. And if you look at the diamonds and the forest plot, you see how few diamonds are here. And in fact, this trial based on 22 patients was weighting much more, deciding on the general results that favored the exercise. What the patients say about the attitude, what is the attitude, their attitude towards physical exercise after transplantation. This is the very small trial. This is the very small study based on 19 patients, but what is unique that all the patients were more than 25 years after kidney transplantations. They were asked, to what do you attribute the longevity of your kidney transplant? And some thought that it was luck. So some showed social support, but almost all said the healthy lifestyle was critical for the longevity of the transplant. But in fact, the patients who are after transplantation have fears of movement, and also very low self-efficacy. And this is the analysis that I underlined the important correlates. So self-efficacy influenced the fear of movement, of course history of cardiac events. And what was most important, that it correlated well with the total daily physical activity, with sports and leisure time. Those who were interested in sports, who had some experience with sport, have no fear of movement, and were more active. And also, so occupation also was important. And now the world is changing, so we have better ways of communicating. We have smartphones, we have telephones, and so on. We have internet. So it's important to see that the patients are also changing. What are the attitudes and perceptions of them towards mobile health delivered physical activity programs? The patients were asked about their attitudes towards the modern technologies, and 100% of them were interested in fitness trackers. And almost more than 60% owned a smartphone. And they said they are interested in using programs who track fitness, but only if the programs are free. This is all of them answered in the same way. But it's also important when we take into account any programs. So pedometers. This is the very simple way to increase physical activity. This is very cheap, easy to use, but has some, of course, disadvantages. Like, for example, the patient can manipulate something and improve to please his or her doctor the results. And it's only good for walking, not for jogging. So we look at the patients. This is a very difficult population of hemodialysis patients. We looked at the patients were only wearing pedometers, and we look at the results, whether they will increase their spontaneous habitual physical activity. And we found that it was true, but it was not so evident for the between dialysis days, especially during the long break during the weekend. So they were not so likely to increase their physical activity. But this is the very difficult population. But in fact, that has one advantage when studying, because they come 3 times per week for the dialysis, and we can ask them to take physical exercise. We can educate them in that time. It's not the case if the patients after transplantation. And in fact, the similar study was performed recently. This was a 90-day pedometer-based physical activity intervention, and adherence to the prescription was only 36.5%. So it will not work. But there was, of course, there were some benefits, small benefits on blood pressure and glucose control. We have more sophisticated devices than pedometers, like accelerometers, but they are much more expensive. They give much more information about duration and intensity of physical exercise, any kind of movements. They measure any kind of movement, estimates energy expenditure. So they are good for research. We use it for our study, recently submitted study, that first the patient had a supervised physical activity, then they trained at home, and they were monitored with the accelerometers, body composition monitor, quality of life, and so on. This is just another piece of research, but not for all the patients. So now that we have in many areas of medicine, we have pedometers program, but they're web-based, based on web-based education, bidirectional communication, and very important that there are internet forums that also help patients, but not all the patients. The patients should be interested in using internet and be on a forum. There are many recent reviews on smartphone applications for promoting physical activities. But unfortunately, there are only few in patients after organ donation. This is the future. The future is, in fact, so-called e-medicine, e-health, telemedicine, personalized medicine, tailored therapy, and so on. There are many names. This is the most accessible e-medicine, because those are smartphone applications. Most can be used for free. But there are, of course, some paid applications. But of course, telemedicine means, or e-medicine means something more sophisticated, like in cardiology. So it's not only the smartphone applications, but they could help, in fact. And I look at the studies in clinicaltrials.gov, in the largest database of new clinical trials or ongoing clinical trials with the physical exercise and kidney transplantations. And I found only 7 studies, and 3 of them look at the effects of technology applications to improve compliance in adolescent renal transplantations, also compliance with lifestyle and with exercise. So it seems that most of the studies were in Europe and in the United States, nowhere else. So this is the future is better described of this consensus recommendations for a research agenda in exercise in solid organ transplantation, published 2 years ago in the American Journal of Transplantation. And I will like to show you the recommendations. In fact, there are 3 areas. One is partnership. This is the most important, I think, that the link with patient advocacy groups. Also, the guidelines. We still don't have good guidelines. We should develop them. And then infrastructure, availability of existing hospital gyms, but it is expensive. And what I underlined, use of telehealth and home-based programs to increase compliance with exercise and physical activity. Especially, it's important in the late post-transplant phase. And with these future recommendations, I would like to thank you for your attention. Thank you.